Welcome to Aesthetic Art. Dr. Maya Kato is board certified by the American Board of Otolaryngology, Head and Neck Surgery, and has performed thousands of procedures. Dr. Kato specializes in a variety of procedures, including neuromodulators and fillers.
So let's talk about what the difference is between a neuromodulator and a filler. There's a very common misconception that any injectable is Botox. So Botox falls into a category that we call a neuromodulator. And neuromodulators, like Botox and like Dysport, help to smooth out the wrinkles by relaxing the muscles that create those facial expressions. And so by and large, neuromodulators are very useful in the upper 1/3 of the face. Their action is very different than a dermal filler. Dermal fillers smooth out wrinkles by injecting a gel-like substance underneath the skin, and we use this to replace the lost volume that patients have over time. So in this way we revolumize the face and make it look more youthful. So the things that fall into the category of dermal fillers fall under the name of Juvederm. So we have Juvederm Ultra, Ultra Plus, Voluma, Radiesse, and then the Restylane family of fillers, which includes Restylane Lift, Restylane Silk, Refine, and Define. So there's a whole host of these dermal fillers, which by and large are for the most part made out of a substance called hyaluronic acid. Hyaluronic acid, or as we call it HA, is a substance that naturally occurs in the body, so it's very safe and our body tolerates it very well. There's no allergic reaction or any real danger to having it injected if it's injected properly. Then finally we have something called Sculptra. Sculptra is a volumizer for the face. It works similarly yet differently than the HA fillers. Sculptra, I like to think of it, and I discuss it with my patients, as Sculptra are like seeds that we lay into the ground, and then we're stimulating your body to generate its own collagen. So in this way, Sculptra can create a really beautiful, youthful look to the face because it's gradually volumizing the face over time. And the collagen that you grow is your own, and it can stay with you for as long as 2 years. Here in Southern California, we see a lot of patients who've had effects of the sun. They've gone to the beach, they're tennis players, they're golfers, and we know how the sun really damages our collagen. And so really, who are these injectables for? They're for anybody from as young as 21. I don't know that we actually put an upper age limit on these things. We often have younger patients coming in who may be squinting from looking at the sun, and they're developing that frown line between the eyebrows. So they're asking for just a little bit of Botox, which is good not only for treating that wrinkle that they have now, but we recommend it for prevention. And so for our Botox and our Dysport patients, we recommend that they come in regularly every 4 months, because it's certainly much better to prevent a wrinkle from happening than to have to try to treat it once it's deeply ingrained. Another group of patients that we see that is really a growing market is the male population. You know, injectables and cosmetics are not only for women. Men want to look younger too. Americans are living longer, they want to look good, and when we're treating the wife and she's starting to look a decade younger than the husband, then he wants to come in and keep up with her. So the male population is one that's not to be forgotten as well.
Call Aesthetic Art today at 760-610-5558 or visit us online at drmayakato.com to book your complimentary consultation with Dr. Maya Kato.